Alzheimer's versus dementia. Understanding the key differences. Alzheimer's disease and dementia are two terms that are often used interchangeably. However, they are not the same thing. Both diseases can have a significant impact on a person's cognitive function, but they differ in their causes, symptoms, and treatments. Understanding the key differences between Alzheimer's and dementia is critical for both patients and caregivers. In this post, we will explore the differences between Alzheimer's and dementia to help clear up any confusion. We'll describe the symptoms of each disease, their causes, their effects on the brain, and the treatments available. Whether you're caring for someone with Alzheimer's or dementia or you're just curious about the differences between the two, this post will provide you with the information you need. 1. Introduction to Alzheimer's and dementia. Alzheimer's and dementia are two terms that are often used interchangeably, but there are important differences between the two. Alzheimer's is a specific and common form of dementia, which is an umbrella term for a range of cognitive disorders that affect memory, thinking, and behavior. Alzheimer's is the most common form of dementia, accounting for 60–80% of cases, and is typically associated with the gradual decline of memory and cognitive function. Dementia, on the other hand, is a broader term that encompasses a range of conditions that cause cognitive impairment, including Alzheimer's, vascular dementia, Lewy body dementia, and frontotemporal dementia, among others. While Alzheimer's and dementia share some similarities in terms of symptoms and effects on the brain, it's important to understand the differences between the two conditions in order to provide proper care and treatment for those affected. In this article, we'll explore the key differences between Alzheimer's and dementia, including their causes, symptoms, and treatments, to help you better understand these complex cognitive disorders. 2. Defining dementia and Alzheimer's. Dementia and Alzheimer's are two terms that are often used interchangeably, but they are not the same thing. Dementia is an umbrella term used to describe a group of symptoms that affect cognitive functioning, such as memory loss, communication difficulties, and changes in mood or behavior. Alzheimer's, on the other hand, is a specific type of dementia that accounts for 60–80% of all dementia cases. It's a progressive disease that affects memory, thinking, and behavior, and it gets worse over time. While dementia can be caused by a number of underlying conditions, including Parkinson's disease and Huntington's disease, Alzheimer's is characterized by the accumulation of abnormal protein deposits in the brain that cause brain cells to die. This damage to the brain can lead to problems with memory, thinking, and behavior. It's important to note that while Alzheimer's is a type of dementia, not all dementia cases are Alzheimer's. Other types of dementia include vascular dementia, Lewy body dementia, and frontotemporal dementia. Each type of dementia has its own set of symptoms and underlying causes, and a proper diagnosis is essential in order to provide the right treatment and support for the individual. 3. Common symptoms and risk factors. While Alzheimer's and dementia are often used interchangeably, it's important to understand that they are not the same thing. However, there are some common symptoms and risk factors that are shared between the two conditions. Memory loss is one of the most common symptoms of both Alzheimer's and dementia. However, with Alzheimer's, memory loss tends to be more severe and progresses over time, while with dementia, memory loss is often milder and may not progress. Other symptoms that are common to both conditions include difficulty with language and communication, as well as changes in mood and behavior. People with Alzheimer's or dementia may experience confusion, anxiety, depression, and emotional instability. There are also risk factors that increase the likelihood of developing Alzheimer's or dementia, such as age, genetics, and lifestyle factors like smoking, poor diet, and lack of exercise. However, it's important to note that having a risk factor does not necessarily mean that someone will develop the condition. Understanding these common symptoms and risk factors can help individuals and their loved ones identify early warning signs and seek treatment or support as needed. If you or someone you know is experiencing memory loss or other symptoms, it's important to speak with a healthcare professional for an accurate diagnosis and appropriate treatment. 4. Key differences in symptoms and progression. It is very important to understand the key differences between Alzheimer's and dementia. While Alzheimer's is a type of dementia, it is not the only type. Understanding the differences in symptoms and progression can help you make informed decisions about care and treatment options. Alzheimer's disease is a progressive condition that affects memory, behavior, and cognitive function. One of the key symptoms of Alzheimer's is memory loss, particularly of recent events. As the disease progresses, individuals may also experience difficulty with language, problem solving, and decision making. In the later stages of the disease, individuals may experience difficulty with basic tasks such as dressing, eating, and bathing. Dementia, on the other hand, is a broader term that refers to a decline in cognitive function that interferes with daily activities. There are several types of dementia, including Alzheimer's disease, vascular dementia, and Lewy body dementia. The symptoms of dementia can vary depending on the underlying cause, but generally involve memory loss, confusion, and difficulty with communication and daily tasks. While some types of dementia may progress more rapidly than others, the symptoms generally worsen over time. It is important to note that there is currently no cure for Alzheimer's or dementia. However, early detection and treatment can help manage symptoms and improve quality of life for individuals and their caregivers. If you or a loved one are experiencing symptoms of Alzheimer's or dementia, it is important to speak with a healthcare professional for an accurate diagnosis and appropriate treatment options. 5. Diagnosis and treatment. Diagnosis and treatment of Alzheimer's and dementia require a highly skilled and experienced healthcare professional. A diagnosis of either Alzheimer's or dementia is often made after a series of physical and neurological tests, including memory and cognitive assessments, blood tests, and brain imaging tests. It's important to note that dementia is not a specific disease, but rather a term used to describe a range of symptoms associated with cognitive decline. Once diagnosed, there are a range of treatment options available to help manage the symptoms of Alzheimer's and dementia, including medication, therapy, and lifestyle changes. Medications such as cholinesterase inhibitors and memantine are commonly used to help manage symptoms of Alzheimer's, while therapy, including cognitive stimulation therapy and reminiscence therapy, can help improve memory and cognitive functioning. It's important to note that there is currently no cure for Alzheimer's or dementia, and treatment is focused on managing symptoms and improving quality of life. Lifestyle changes such as regular exercise, a healthy diet, and social engagement can also help improve symptoms and overall well-being. In some cases, alternative therapies such as music therapy or art therapy may also be recommended to help manage symptoms and improve quality of life. It's important to work closely with a healthcare professional to determine the best treatment plan for your individual needs. 6. Coping strategies for patients and caregivers. Coping with Alzheimer's and dementia can be challenging for both the patient and caregiver. It's important to understand that the patient's behavior is not intentional, as the disease affects their brain function and memory. Therefore, it's essential to be patient, calm, and understanding when dealing with patients who have Alzheimer's or dementia. Caregivers should create a routine for the patient, as it helps to reduce confusion and anxiety. It's important to maintain a consistent schedule for meals, activities, and sleep. Also, avoid introducing new activities or environments as this can cause confusion and distress for the patient. For the caregiver, it's essential to take breaks and seek support from family, friends, or support groups. Caregiving can be exhausting and emotionally draining, so it's important to have a support system in place to avoid burnout. Additionally, it's important to keep the patient engaged in activities that they enjoy, such as music, art, or puzzles. These activities help to stimulate the brain and improve mood and behavior. Finally, caregivers should ensure that the patient is safe and secure at all times. Patients with Alzheimer's or dementia are prone to wandering, so it's crucial to install safety measures such as locks on doors, window alarms, and wearable tracking devices to ensure their safety. 7. Preventative measures and lifestyle changes. While Alzheimer's and dementia are both complex conditions with no known cure, there are certain preventative measures and lifestyle changes that can be taken to reduce the risk of developing these conditions. Here are a few key tips. 1. Exercise regularly. Studies have shown that regular exercise can help maintain brain health and reduce the risk of developing Alzheimer's and dementia. 2. Eat a healthy diet. A diet that is rich in fruits, vegetables, whole grains, and lean protein can help reduce the risk of developing cognitive decline. 3. Stay mentally active. Engage in mentally stimulating activities such as reading, puzzles, and games to keep your brain active and healthy. 4. Manage chronic conditions. Conditions such as high blood pressure, diabetes, and high cholesterol can increase the risk of developing cognitive decline. Managing these conditions through medication, lifestyle changes, and regular checkups can help reduce the risk. 5. Stay socially engaged. Social engagement can help reduce stress and improve overall brain health. Stay connected with friends, family, and community groups to maintain a healthy social life. While these preventative measures and lifestyle changes cannot guarantee the prevention of Alzheimer's and dementia, they can help reduce the risk and improve overall brain health. 8. Latest research and advancements. Recent years have shown significant progress in the research and advancements made in the field of Alzheimer's and dementia. There are now more treatments available that can help slow down the progression of these diseases and improve the quality of life for those affected. One of the most significant advancements recently made in Alzheimer's research is the discovery of biomarkers. These biomarkers can indicate the presence of Alzheimer's disease years before the onset of symptoms. This breakthrough discovery has opened up new avenues for early detection and potential treatments. Another promising area of research is the use of stem cell therapy. Researchers are investigating the potential of stem cells to repair the damage caused by Alzheimer's and dementia. While still in the early stages of research, this treatment shows great potential for the future. It's important to note that research and advancements in Alzheimer's and dementia are ongoing. It's vital for both individuals affected by these diseases and their caregivers to keep up to date with the latest information and developments. By doing so, they can be better equipped to manage the symptoms and find the best available treatments. 9. Support resources and services available. If you or a loved one has been diagnosed with Alzheimer's or dementia, it's important to know that there are many support resources and services available. Organizations such as the Alzheimer's Association and the Dementia Society provide a wealth of information, resources, and support to those affected by these conditions. They offer education and training programs for caregivers, support groups for individuals with Alzheimer's or dementia and their families, and advocacy efforts to raise awareness and funding for research. In addition, there are many healthcare professionals, including doctors, nurses, and social workers, who specialize in working with individuals with Alzheimer's and dementia. They can provide medical care, assistance with daily activities, and guidance on managing symptoms and behaviors associated with the conditions. It's important to seek out these resources and services to ensure that you or your loved one receives the best possible care and support throughout the journey with Alzheimer's or dementia. 10. Conclusion. Understanding the differences and moving forward. In conclusion, it's important to understand the differences between Alzheimer's and dementia because they are two separate conditions that have similarities but also distinct differences. Alzheimer's is a disease and is the most common cause of dementia, while dementia is an umbrella term that covers a range of conditions that impact cognitive function. Knowing the differences can help in seeking the appropriate medical care and support for those who may be impacted by these conditions. While there is no cure for Alzheimer's or most types of dementia, there are treatments and support available that can improve the quality of life for the individual and their loved ones. It's important to work closely with a healthcare professional to get the right diagnosis and develop an appropriate care plan. Additionally, there are many resources available for caregiving, education, and support groups that can help individuals and families navigate the challenges that come with these conditions. Ultimately, by understanding the differences between Alzheimer's and dementia, we can better support those affected and work towards finding effective treatments and hopefully one day, a cure. We hope that this article has helped you understand the key differences between Alzheimer's and dementia. Although the terms are often used interchangeably, they are not the same thing. Understanding the differences can help you better understand the symptoms, treatment options, and how to care for your loved one. If you suspect that someone you know may be suffering from Alzheimer's or dementia, we urge you to consult with a healthcare professional for guidance and support. Remember, you are not alone in this and we are all in this together.